might feel different. I try as much as possible not to tell the patient these things that, oh, this side feels much thicker than this side. I let them make those calls because I know over the decades I've been doing this work that sometimes the side that I feel the problem on, like, oh, this side feels all scarred down, the patient might say, no, I feel that more on the other side. Okay. Or I could say to her, take your hands over mine and show me how much pulling you might like. Take two hands. Is there anything about what we're doing right now that feels dangerous or a waste of time? Is there anything about what we're doing right now that feels like it might be helpful? Yeah. Is there anything you want me to change, meaning we could go in different directions? I'm just lateralizing ever so. You like it just straight out? Got it. Adding useful aspects of, that relate to the person's issues, I think it gets even more beneficial. For instance, I'm doing a bilateral elevation. I ask my patient to swallow. I ask them to voice. I ask them to try to move their tongue, pull it down to the floor of their mouth, lift it up, that sort of thing. Moving from that concept of manual therapy as a passive intervention to manual therapy as an active intervention, one that doesn't build dependency. We're trying to allow them to engage while we're engaging them as well. And like that. The nuances you're going to figure out yourself, okay? All I want to do with hooking one side or the other, I want to give you a really strong comparison, one side and the other. And I might say, I want you to remember all of this, because I might ask you, did any of these feel more therapeutic than the other? So what you want to do is have them basically get their tongue like this model has right here. So the tongue is resting easy on the inside of the mouth, inside of the teeth, I should say. Don't want the tongue retracted. I want to be able to get the tongue like that. So I come in with my tongue, with my thumb flat, and then I essentially do that. And I begin pushing downward. Now, this thing is not moving, so I'm going to show you on my hand, all right? You're coming in. You're on the anterior third of the tongue. Rest it, then tip, and then start pressing downward. What I want to do is I want to depress the tongue until it gently bottoms out on the floor of the mouth. Some patients, you do a little and boom, you hit the wall. You can't go anymore. Other patients, you start going down and it feels really soft and it continues to go. You want to take it without threatening, without hurting them. You don't have to prove your strength here. You want to bottom it out at the floor of the mouth.